Hello and welcome. I've been getting some questions about the coronavirus outbreak, both in terms of what's happening and also what we can do to respond to it. Now, I'm a professor at University of Washington Bothell in the School of Nursing and Health Studies, and while I'm not an infectious disease expert, I have been teaching about infectious disease as part of my other courses for about 10 years. So I currently live in Bothell, Washington, which is very close to Kirkland, which is one of the first places that coronavirus really popped up in Washington state. And so we are taking this very seriously in this area. And I will say I've been sick myself. I've been self-isolating for the last week and a half. And it's something that is a real challenge for us to think about in terms of the different ways that we can respond. I'll note here that I'm going to be talking about what information we currently have about this. And this, I'm going to speak pretty plainly about it, which might be somewhat stressful to some folks. So if you're feeling stressed about this right now or feeling like maybe this isn't the right time, you don't have the resources for it at the moment, maybe don't watch it now. You can view it at a later point. But overall, I think that we're best off when we understand what we're facing and what the opportunities are for addressing it. All right, so what are we going to cover? So the first thing we're just going to talk about is, generally speaking, what is happening. What is this outbreak and where does it come from? Then we're going to talk about how infections occur with the coronavirus and what the impact of that infection is on people's health. Then we'll talk a little bit about how the virus spreads from one person to another and what the risks of that are, generally speaking, for different groups. And then we'll talk a little bit about some of what we can do about this, how we can respond to this potential health risk. So before I start up, I do want to add some caveats. So the first thing is that this is very new. This is a new virus. We're still very much learning. So there's new information coming out every day. Some of the data in this presentation was actually just discovered in the last day or two. So this is changing very fast, and not only are we finding out more about the virus, but we're also finding out new and better ways to address the virus as we go forward. So one should expect that the recommendations and some of the information I'm sharing here will change, possibly even by tomorrow. So understand that this is a fluid situation. And just for context, as you're thinking about this, know that this video was created on March 14th. So that's sort of the time frame that this data is coming from. All right, so what's happening, generally speaking, with respect to the coronavirus? Well, the coronavirus disease of 2019, which has been abbreviated as COVID-19, is actually a coronavirus that we believe was transmitted from bats into pangolins, which then in turn transmitted the virus to humans. So you've probably heard of the SARS outbreak of 2002. It's a SARS virus, so it's very similar in terms of composition to that virus. It just has different genetic traits and different types of health impacts. So what we know about it is that we think that it first transmitted in humans probably in November or December of 2019, which is why it's called coronavirus disease of 2019. And we know that since then, it mainly expanded in the Wuhan region in China initially, and then has spread out more broadly. Now, this is currently the data about where this coronavirus is. The initial outbreak occurred in China and then spread. There's other locations, Iran, Italy, that also have substantial outbreaks as well. And it really is found across the globe at this point. So it really is seen as being a pandemic. Now, within the United States, we see that there is a distribution of people who've been tested positive for COVID-19 around the United States. This is recent data, just from the last day or so. Currently, where I am now, we have about 600 people who have the coronavirus and about 40 people who have died in Washington state as a result of that. Now, what we know is that this is only the data for the people who've tested positive for this, but we actually haven't had a lot of testing done so far in the United States. And what that means is that we expect that, if you see 600 people in Washington state, we expect that there's many thousands of people who haven't been tested yet, who are already having symptoms, and maybe even more who don't have symptoms and aren't aware that they have this disease. So it is definitely a concern for a region. And just so you can see that there is a relatively rapid progression in terms of tested people with this disease. On March 5th, it was about 159, and now we're up to about, on the 14th, we're up to about almost 3,000 people who've been tested positive for it. So as you can see, this is an outbreak that's ongoing and that we really need to be paying attention to. And as you're watching in the news, you'll probably notice that there's been changes in response to this. We now have a national state of emergency around dealing with COVID-19. You might find in your state, for example, Washington state, we have closures of schools and recommendations for limiting business to essential personnel, for example, limits on gatherings, particularly large gatherings, and a range of other changes that we're pursuing to try and limit the spread of this disease as much as possible. And to the extent that we can pursue these recommendations will really determine how fast this disease spreads and how much we're actually able to reduce the number of people who get infected by it. So how does an infection occur? Well, COVID-19 is a virus, so it's a single-stranded RNA that's surrounded by an envelope, and that envelope has protein spikes on it that look a little like a crown, which is the name where the name corona comes from. And these viruses can be transmitted from one person to another. So if someone coughs or even speaks or breathes, water droplets, very small water droplets that you probably can't see, are emitted, and they can travel some distance. Probably about roughly 6 feet is what we're currently seeing or currently recommended, is that is sort of the distance at which we see most of this virus spreading. But it can live for a fair amount of time on surfaces. So it can, depending on the surface, it can last from a few hours up to several days. So, the way that it spreads is either by inhaling or encountering that virus, or perhaps touching it on the surface and then touching your face and transmitting it in that way. So this is essentially how it passes from one person to another. And there's some other ways, fecal oral routes or other ways that can happen. But this is the main one that we're focusing in on typically. So what can happen here is that as you breathe in these water droplets or there's other type of transmission, it enters the body and it will infect a cell. The body is pretty good at fighting these things off, but if you have a virus that manages to take root, what it can do is it will take over the cell and take over the machinery of the cell, and that cell will start producing lots of viruses, and then it will emit more viruses that will then infect other cells. So that's how it spreads throughout the body. Now, initially, you're not going to have any symptoms because it's only a few cells. But as it spreads throughout the body, you'll start having a health impact. So what is the health impact that we expect from COVID-19 infections? Well, we have some data around this. So first off, in terms of the population, most infections are on the more mild side in terms of being a type of condition that you can handle living at home. So that would be symptoms similar to a flu. So it might, it's going to be unpleasant, perhaps, but you can handle it. And in that category of about 80%, 81%, ranges up to people who are having walking pneumonia. So pneumonia is where you sort of start seeing the threshold that we move over into severe cases. And that's cases where people are starting to have trouble breathing or having other severe health impacts from coronavirus. So we have about 14% of the population that has severe cases, severe responses, and about 5% that has a critical response. And this is based upon global data. Now, I want to say a couple words about people who generally have a mild impact. So again, like I said, mild is actually still a fairly unpleasant response, perhaps. But there's actually a fair number of that 80% who don't have any symptoms at all. We know from the cruise ships that it seemed like about half of the people who actually were tested positive for the virus didn't ever actually have any symptoms of that virus. So it is possible that you have the virus without even being aware of that fact. So one of the things that we need to pay attention to is really trying to protect as many people as possible to prevent the number of people who fall into that severe or critical category and keep those numbers down. So what are the symptoms that you can expect from coronavirus? So the most common symptoms of coronavirus are fever, and we see about 90% of people having a fever, having a dry cough, and that's about roughly 70% of people who have that dry cough. And then fatigue is pretty common, with about 40% of people being quite tired as a result of this infection. There's also some less common symptoms, and these are ranked from more common to less common. So the more common ones are headaches, and that's in the 30% range, down to diarrhea, which is around the 3% range. So these are other things that you can potentially see as a result of a COVID-19 infection. Now, for people who have a very severe response, and there are some people who, as I mentioned, about 20% of the population who have a very strong response to this that may require hospitalization or intensive care, they might be having high fever, they might be coughing up blood, there might be a decrease in white blood cells or kidney failure, and the big one to really pay attention to here is difficulty breathing, because that's the pneumonia effect that really is indicating that transition to more serious disease. So in more serious cases, what we can have is severe lung damage, pneumonia, where essentially what you're having is that the virus is resulting in fluids and mucus building up in the lungs. You can also have the virus spreading to other organs and also causing damage to other organs. And this affects through ARDS, acute respiratory distress syndrome, and the infections in the lungs can actually cause damage to the lungs, which is actually pretty unique to coronavirus. And it's one way that clinicians can actually tell whether or not an infection is coronavirus. So again, we're looking for those serious risk factors I showed you on the previous slide, and also difficulty breathing. And if you're having some complex of things that you think might be coronavirus, you would call your clinician to see whether or not you should get tested. I should also note here that some of these, in more serious cases, this can have long-term impacts. And when you're hospitalized, it can take a fair bit of time. So sometimes hospitalization can take 2 weeks to 6 weeks sometimes in terms of recovery. So this is a serious thing to be paying attention to. Okay, so how does this coronavirus spread from one person to another? Well, this is the stages of infection, and this is just a general slide looking at how infectious diseases generally spread. So we're actually all familiar with this because all of us have had infections of various sorts. So the first thing is an invasion of the body by a pathogen, and we don't notice that. That happens through it entering our body in some way or another. And then there's going to be an incubation period, and that's a period at which the virus or the bacteria is growing in the body, and we don't really we're not usually aware of it as it's growing in the body and replicating itself. Okay. Then we have the prodromal period. All right, and this is the period where we start having some early signs and symptoms, maybe a little bit of a cough, or maybe a little bit of a raised temperature, something that we might not notice. And we call this period, the incubation period and the prodromal period, the subclinical infection. All right. So this is before we've reached a point where we say, oh, we really need to seek clinical attention, some sort of care for this condition. Then we have what we call the illness period, and this is when we have clinical signs and symptoms and should be seeking clinical care. And then as that sort of dies off, we get to the convalescent period, and that's where the signs and symptoms are receding, the body is recovering, it's fought off this illness. And for coronavirus, this can take some time. From the peak of symptoms, it can take 3 days to 7 or 8 days. And people may actually still carry the virus in their system for a little while after. So We don't know, there's a few things that we don't really know about how the coronavirus extends. We think that once you're infected, that you then become mostly immune to coronavirus, getting reinfected by coronavirus. We think that that's true. There is a possibility that because you develop antibodies that allow you to fight off that virus, and you have your immune response is prepared to fight off that virus. But there is some possibility of reinfection, and there's also the possibility that the virus could mutate, and that could allow someone to be reinfected. So there is still possibilities of that, but for the time being, what we currently think is that if you get infected, at least for a certain length of time, you should be immune to COVID-19. So one thing that I want to point out is at the bottom, and you see at the bottom there's this bar which says period of communicability. So this is a period in which people could actually transmit the virus onto somebody else, all right? And that usually starts somewhere in the prodromal period, possibly in the incubation period, where you could start emitting viruses and have that impact other people. So we're going to talk about that and why when that happens is very important. So when we're thinking about transmission, again, the idea here is that most of the transmission occurs, we think, primarily through droplets leaving the mouth, landing on surfaces, or being inhaled. We think that the distance that is mostly prevents most risk is if you're over 6 feet away from somebody, you're less likely to be infected. We know that when people are infected, usually the incubation period itself is about 5 days. So the length of time before we start seeing symptoms on average is about 5 days. And that ranges from about 2 days up to possibly even 14 days. So if you've been exposed, you might have to wait as much as 14 days to know whether or not you have coronavirus. Now, here's a really big question. The question is, for people, I've told you that many of the people who get the disease actually don't have any symptoms at all. So can the people who don't have symptoms actually breathe out the virus and infect other people? So they could have the virus, they could be replicating the virus, but not really have any impact from the virus. So it turns out that people who don't have symptoms, or are called asymptomatic, they actually can transmit the virus to other people. And we previously thought that the main people transmitting the virus were people who had symptoms and were coughing, for example, and transmitting that disease. We thought if people isolated themselves once they had coronavirus, that we would prevent most of the spread of the disease. However, recent results from Singapore and China suggest that about 2/3 to 3/4 of infections are actually the result of transmission from people who had no symptoms at all. All right. So this is actually really important, because that means that looking at somebody or noticing that you have symptoms is not necessarily an indicator for us whether or not we could transmit it to somebody else. We may just not know that we may have the disease and not know it, or we may not have developed those symptoms yet. So this is really important for us understanding this. So what this suggests to us is that preventing people, even who don't have symptoms, from interacting with another might be a way of substantially reducing the spread of this condition. All right. So I want to say a couple of words about how different types of diseases, how good are they at infecting different people. There's a term for this in the field, which is called the reproductive ratio, or R naught, with R with a 0. So what this essentially means is, for one person who has a disease, how many people are they likely to then infect, right? So for hepatitis and Ebola, for example, those are diseases that we might be familiar. If one person develops that disease without other intervention, we expect on average that about 2 people will be infected. There's we see for HIV and mumps and measles, that number can be much higher, okay? So what this tells us is how easy it is for other people to get an infection from a person. Now, what do we know about COVID-19? Well, COVID-19 looks roughly like hepatitis and Ebola. It's somewhere in the 1 to 3 range. Most estimates guess that's around 2.3 for that reproductive ratio. Now, the reproductive ratio is going to vary. It depends on a few different factors like the climate of the area, on factors like what types of preventive measures is the community taking. So this is going to vary. Now, what we'll note here is that what does it mean? How does it spread? What is this curve that we expect to see with different types of reproductive ratios? Well, like I said, one person will, on average, infect 2 people, right? So here's a picture. You have one person infected who could infect 2 people, and then each of those 2 people could infect another 2 people, which makes a total of 4 people. And then those could infect another 2 people, which results in a total of 8 people, who could infect 2 additional people, which results in 16 people. So what this is called an exponential curve, where you have a relatively rapid increase in the number of people who have a disease in these types of situations. So how does an epidemic end? Well, that happens basically when the reproductive ratio gets below 1, right? So if you have a reproductive ratio of 1, then one person is passing it on to one person. So you have sort of a steady level state. Once it gets below 1, that means that there's less people being affected than there was to begin with. So you start to see the disease in the population dropping off, right? So how this looks for COVID-19 is that when people get infected, they develop the disease, and then after they clear that disease from their system, we believe that they are immune. All right. So here in this picture along the side, you see that you have in blue, you have people who are healthy and have not been infected yet. And then you have people in red who have an infection. And depending on how much they interact with the people around them, they might start infecting other people who might get the disease and then become immune to that disease. The other way that you can prevent this spread from occurring is actually having a distance. So for people who have a disease, if they never interact with people, they never encounter people, and then they clear the virus from their system without infecting anyone, well, then that means that the virus is going to start to peter off and disappear, right? Because it's not passing from one person to another. And that's what we call social distancing. So those are the 2 major ways at this point for this condition that we will prevent disease transmission. Social distancing, cleanliness, and hygiene to prevent the disease from passing from one person to another. Now, there's other strategies that can be used. We'll talk about some of them. A major one that we often talk about is vaccination. We don't have vaccines at the moment, but at this current point, those are sort of the ways that we will eventually get that R0, that reproductive ratio, under 1, so that the epidemic ends. All right. So that's talking a little bit about how this disease transmits from one person to another. Another thing to consider is, okay, if someone gets this disease, what are the risks that we're looking at for our population, and who is most vulnerable to this disease? Well, we've already talked about the reproductive ratio, and this is just a way of putting this disease, COVID-19, in a larger context. So along the bottom, we see the reproductive ratio going from 0 up to 9. Okay, so how many people are infected by the disease. And along the other axis is how many people die as a result of this disease. So we know that there's a range of different conditions with different types of risk. And at the bottom of this scale, we go from 0 up to 60, but at the bottom it's logarithmic. So it's 0, 0.1, 1, and then 10, and then it's going up from there on a different scale. Now, for COVID-19, what we're seeing is the range for our reproductive ratio, as I mentioned, is from roughly 1.5 up to 3. And in terms of the number of people who are dying, we're seeing roughly in the 2% range internationally, 2, 3. I think on average globally it's about 3.7 at this point. This is somewhat similar to sort of the transmission profile that we saw in 1918 for the Spanish flu. So the Spanish flu was a very serious flu that spread around the globe. It actually made multiple circles around the globe. And within a matter of months, about 6 months or so, it actually killed, they estimate, between 50 to 100 million people. So a very serious flu that in some ways has similarities to COVID-19. However, what I'll note is that at that time, they didn't have a lot of our strategies that we currently have for actually addressing disease. It also had a much faster impact. So people would develop this disease very, very fast for the Spanish flu. But the point here is that we've actually learned a lot from the Spanish flu about different strategies that we can use to decrease people's risk for this disease. So what does the CDC anticipate for COVID-19? So they put together some projections which they put forth for the United States about risk based upon COVID-19. And what they said based upon current data, if we do nothing, if everything stays as it is, we would get about 160 to 214 million people be infected in the United States. That epidemic could last for a pandemic, outbreak could last for from months to over a year. We would expect to see between 2.4 and 2.1 million people having to go to the hospital, and potentially 200,000 to 1.7 million deaths. So very, very serious. Now, what I'll note here is that this is based upon the assumption that we're not doing anything to change the way that we behave, the way that we interact with each other, and essentially carrying out business as usual. But we already know that people are engaging in behaviors that will decrease their risk for getting the disease or passing it on to others, and that there are policies in place to start dealing with this. So we think that this is more of a worst case scenario at this point, rather than what we probably expect to see, which is probably very much on the lower end of that range that was presented there. The other thing that the CDC mentioned, which I think is important to pay attention to, is the impact on our healthcare system. So remember, when we have a lot of people getting infected, we don't want too many people to get infected at once, because we only have about close to 1 million staffed beds in hospitals to take care of people, and only about 10% of those are ready to take for critical care. All right, so we don't want to overwhelm our healthcare system, so that everybody has the care that they need to help them get through their infection successfully. So as I've mentioned before, most people who do get this condition do recover. So we see an average global rate of about 3.7% of people dying. Currently in the United States, I think that number is about 2%. So that's what we're looking at. And then we have what we're finding is that the risk for this disease varies substantially based upon the age of the people who are infected. So this ranges from fairly low for younger people up to ranges for people in the 60s, 70s, and 80s being really quite substantial in terms of their risk. So the point here is for the people who are at lower risk, all right? So one thing I want you to pay attention to is that you still do have a risk. So I'm in my 40s. I have a 0.4 risk, so that's about a 1 in 200% chance of dying for me. For me, that's actually pretty risk. I think that that's a pretty high number. 1 in 200. There's not many things I do in my life that are that risky. So for me, I'm really interested in not getting COVID-19. So the other thing for us to pay attention to if we're at lower risk is we need to think about this not just in terms of our risk for ourselves, in terms of our health risks, but also the risk that we would pass this on to somebody else who is more vulnerable, who does have a much higher risk. So we need to think about what we can do to protect others in our communities. And that's really important. And keep in mind that, there still is that small risk for ourselves. For people who are in that vulnerable population, it's really important to be particularly attentive to the ways that we can prevent ourselves from getting that disease, right? Because it becomes substantially riskier. And something to pay attention to is how many people in your community are sort of fall into that category of people who are at higher risk. The more people you have around you, if you have family members who fall into that category, it becomes much more important to really be very, very careful. Not to say that everybody shouldn't be careful, but that's something to be attentive to. I just want to make a quick point here because there has been some conversation about the risk of COVID-19 being similar to a flu, the common flu. So I just want to show this very simply in this slide. The flu is a dangerous disease, and it does kill a lot of people in the United States every year, often 30,000 or more people per year. However, it just isn't as dangerous as COVID-19. As we see from this chart, with the flu on one side and COVID-19 on the other side, COVID-19 is just a much riskier disease. It just has a much higher mortality rate for people. So please keep that in mind when you're making comparisons. So for those, the other thing in terms of vulnerability is that there are certain diseases that people may already have, which may make them at greater risk for being impacted, for dying from a coronavirus infection. So the main ones that we know about at this point are cardiovascular disease, which has about a 10% risk, diabetes, chronic respiratory diseases of various sorts, abnormally high blood pressure, cancers, and then we see for no existing conditions that the risk is lower. So what this means is that certain groups of people who are going to be more vulnerable based upon their health status. And we also think that there might be things related to immune system response. Smoking might be another risk. So there's other things that we could think about in terms of risk factors for people. But these are the ones that the evidence is really indicating are substantial risk factors. All right, so I've talked about some of the concerning information about this, and I really understand if this is concerning. It would be concerning. Let's try and take a deep breath and think about what can we do? What are the ways that we can respond to protect ourselves and protect other people? And the good thing is that we actually know a lot of things that are very effective at dealing with this. So again, there's a real interest in trying to put forth effort now rather than waiting. And I'm going to talk a fair bit about this. But the quote here that I'm just saying is, months from now, if we're lucky, the extreme measures being taken now limit the spread of COVID-19 may seem like they were an overreaction because relatively few people died compared to what we thought. And what they say is, that's the point. That's why we're doing it. We're taking precautions now to prevent people from having an impact of this disease later. All right. So what do we know about how a disease infects people? So we've already talked about the infection cycle. Basically, you have an organism that we know a fair bit of that about, and one really helpful thing for that is being able to test for that organism, which we can do. Having a reservoir, so knowing where that disease comes from helps us understand how to prevent this disease. Thinking about how that infectious disease leaves a person's body. So where does it come out of? Is it coughing? Can it be released to the skin? What types of ways does this disease spread? And we know a little bit. We know about that for COVID-19. Then also, how does it transmit from one person to another? Is it because you eat food, or is it because you breathe something in? What is that mechanism for passing it on? And then you think about the portal of entry. So how does it enter somebody's body? How does it get into your body to then infect you? Okay. The other thing that we think about with the infection is, who are the people who are at greatest risk, or who may pass this along? So knowing who can pass this on. For example, we know that most of this is passed on by people who are asymptomatic. That tells us a lot about how this disease spreads. So we have a few different strategies that are useful for thinking about COVID-19 prevention. Now, one, and I'm going to talk about some of these in more detail, but one is just killing the virus itself. You can do that by using soap, for example, and good hygiene and cleaning spaces. We can block the virus, so that's barriers, so that For example, general recommendations now are that when you're sick and in places where you might infect people, particularly hospitals, that you wear a mask so it prevents some of those droplets from spreading. Avoiding the virus, so that would be, you can't get infected if you don't encounter the virus. So maintaining a distance from other people and decreasing your interactions with others. You can also test for the virus. So testing the virus helps us to focus in our healthcare resources on people who need it the most, and also to know what we're doing in terms of targeting care to individuals. So at this point in the United States, we have limited availability of testing, but that's something that we're rapidly building up our capacity to do that. The other thing that is helpful, particularly at earlier stages, is to track the virus. So if somebody gets sick, seeing who else they might have infected, who have interacted with them, can sometimes be a helpful way of finding those people and asking them not to spread that virus more. And that's been very effective in some countries. So that's another strategy. Another one is to treat the virus. So when we're thinking about how we can address this, supporting people as they're sick will make a difference, particularly people who have more serious conditions. So currently, most of what we do is supporting people in terms of getting through their illness, allowing their body to respond. But there's also some medications in development that may actually be helpful for helping people fight off that infection. And then there's also the idea of vaccines. Now, vaccines are in development, but most of the estimates I've seen suggest that we probably won't have a vaccine for another year, possibly more. So that's probably not something that's going to help us in the near future. Although it'd be great if we could. But among these different strategies, I'm going to focus on a few because they're really helpful for us in the general public to try and adopt to reduce our risks. All right, so one of the big things that we're trying to do here is called essentially flattening the curve. And I want to tell you what we're looking at right now. So this slide is looking at the number of infections. The higher you are on the slide, the greater the infections. And along the bottom is the amount of time since the first infection occurred in your area, for example. Now, what we're showing here is an orange curve and a blue curve. Okay. The orange curve is what would happen if we didn't do anything, if we just behaved as normal and didn't engage in protective behaviors. And then the blue curve is what would happen if we actually do things like social distancing and preventing cleaning up to prevent viral spread. Now, what's really important here is that white line that's across the dotted white line that's across the middle, which says the healthcare system capacity. So what we really want here, our goal here is that we know that a lot of people probably will get the COVID-19 virus. But what we want to do is slow down the rate at which we get it, all right? What that will mean is that the rate that we're not having too many people have it at the same time. So we see for the orange curve, there's a lot of people who get it all at once. And what this does is it goes past our healthcare system capacity. So as I mentioned, a little sick, I just modeled what you do is you cover your cough so that you don't infect other people. And there's no other people around me too, in case you're worried. So what we're trying to do here is slow down that infection and make sure that we don't overburden our healthcare system. So there's a lot of clinicians out there who are working very hard to help out people who are really sick. And we don't want them to overwork them so that they don't have the capacity to provide people with the treatment that they need. There's only a certain number of beds out there. If we have more people than beds, then we start having a really big problem with respect to addressing this for people who have serious illness. So we really want to slow that out and flatten that curve out. All right. So that's kind of a goal. So we have a few different things that we can do there. And I've already mentioned some of them. One is cleaning up. So cleaning up surfaces. We know, for example, that hand washing makes a big difference. You can soap itself will kill off the virus very, very effectively. It breaks up the envelope and will kill it. So doing that regularly, doing your entire hands, doing it for about 20 seconds or so. You can count a sing happy birthday twice if that helps you to remember. And using these products to kill off the virus makes a big difference. The other thing is, as I mentioned, the virus can live on surfaces. So if you touch a surface that has COVID-19 on it, and then you touch your face, your eye, or your mouth, or your nose, it can be transmitted into your body. So you really want to avoid touching your face. And you see here a picture of the T-zone. Those are the areas you don't want to touch. So that will also make a big difference. So if you get it on your hands and then you later wash your hands and you never touch your face, then it's been killed. So you don't have to worry about it. But if you don't, if you get it on your hands and then you touch your face before you've washed your hands, then you could get that infection. Now, the other strategy is a really important one, and this is one that will require substantial change for a lot of people, and this is called social distancing. All right. So what is social distancing? It's the idea that we want to separate ourselves out physically from other people who may or may not have that disease. Again, we can't tell who has the disease or not, who has COVID-19. It is something a lot of people are asymptomatic, so you don't know. Also, I should note here, and this is just important, we don't want to stigmatize people who are wearing masks or who may have symptoms. Everybody, we got to trust and we got to encourage everybody to be doing their best to prevent risk of spread of this disease. And we want to support people who do get this, right? So again, we want to avoid that stigma. That being said, what we do want is we want to avoid interacting with other people as much as possible. Especially that physical interaction within 6 feet of others. So we want to keep that, essentially the ring around ourselves. And the best way to social distance is just to stay home and not to interact with others. And I'll say some more about that. Now, if you think about social distancing, the reason that works is that essentially it interrupts the social networks. So you can see here, up in the corner of the slide, there's a lot of people packed densely together. They're interacting a lot. They have a lot of different connections. So they have a lot of potential to catch the disease, where if you look further down on the slide, it's less densely packed out. They're having less interactions. And that's kind of what we want. We want to have a lower concentration of interactions with people because each interaction has its own small risk of catching COVID-19. So when we think about the types of risks from interactions, some people might interact. So ideally, you're keeping that bubble and you're not interacting with other people, preferably staying home or staying at a distance from people. But sometimes people will interact directly, and sometimes they have to. So there will be some people who have to interact if you're in a house with other people, for example, or sometimes you need medical care or something. You're actually going to need to interact with other people or go get groceries, for example. Now, remember, every time that you interact with people, you're interacting with them and also the interactions that they've had with other people. So they could have been infected by others as well, right? So the less people that if you decrease the number of people that you interact with, that decreases your risk of that networked exposure to the disease. The other thing that helps with these interactions is to keep interactions shorter. Right? So the less time you're in the presence of somebody else who might have COVID-19, the less likely you are to get that condition. So really what I'm saying here is that our best strategy is to try and just make sure that we create conditions where we have no contact with the virus. That's really the best way of preventing it. If you don't interact with the virus, then you're not going to get the disease. So try and stay home or away from where you might encounter other people as much as possible. Sure, it's fine to go on a walk by yourself or something. Absolutely do that. But trying to keep that separation is important. Avoiding in-person contact is important. Try and actually look for different ways that you can still maintain your social connections. So there's a lot of really fantastic electronic tools, FaceTime, Skype, Zoom. You can make phone calls, you can send emails, you can write letters. There's lots of things you can do to maintain your connections with people that don't involve being physically present. Again, as I mentioned, reducing the number of people, reducing the time, making sure that the distance is further makes a difference. If you're sick, trying to isolate yourself. Well, if you know you have symptoms, you know you're sick, paying particular attention to that. And the other thing that I really want to pay attention to here is that some people can't socially isolate. So we all owe a huge debt to people who are in the emergency response, to our nurses, other clinicians, doctors, other people who are making our healthcare system work, people who are making sure that there's food available and medications available. There are people who are out there taking some risks to make sure that we have the things that we need. So those are people who have less ability to engage in social distancing. So that makes, for those of us who can, it even more important to take this seriously, to take the burden off them, and actually, in some ways, reduce risk for them as well. So again, adopting these social distancing strategies is really important, but also remember that we can think creatively about the ways that we can engage with others and take care of oneself and keep your spirits up, and also support other people in keeping their spirits up. So just to show you that this actually works, here's some data from the 1918 flu that I talked about earlier, the Spanish flu, sometimes referred to, that shows what the impact of social distancing is. So we see the orange curve and the blue curve. The orange curve is for Philadelphia, the blue curve is for St. Louis. So for Philadelphia, it took them almost a month to actually ask people to stay at home and to stop interacting, to do social distancing. And they had this very high peak of the curve. So they really were overrun with the flu. Right? It happened very fast. They had this really high peak, and it had a really major impact for Philadelphia. For St. Louis, however, they had their first case, and within days of their first case, they enacted rules to prevent people from engaging. And what you see is they actually succeeded at keeping that curve down. So we know that if we do this and we take this seriously, it actually can make a big difference for the trajectory of this disease. We also know this from COVID-19. So here's some international data, and you see along the top, along the top of that curve, the higher curve where we see an average of about 33% daily increase in cases. United States is currently on that trajectory, but we see some countries that are much lower. For example, Singapore and Hong Kong, very rapidly, once they had their first cases and once it started happening, because of their experience with SARS and other infectious diseases, they have a good system in place and they know what to do when this happens. And they very quickly enacted social distancing approaches, quarantines and other types of contact tracing and other strategies to try and prevent the spread of that disease. And as you can see, they actually succeeded in doing this, even though there had been a lot of interaction mobility between hotspots and Singapore and Hong Kong. So this is something that does work. We also have some data, for example, locally here. This is data for Bellevue, which is a city nearby. This is just showing essentially computer models that estimate what the trajectory of this disease would be based upon the amount of reduction we take in terms of contact, our interactions with other people. So if we continue on as we're doing with baseline or where people are just interacting, we know that we've already enacted changes, so we aren't doing that now. But if people interacted as normal, we would expect over the next month for there to be about 16,000 additional cases, right? However, if we reduce our interactions by 25%, that goes down to about 5,000. If you reduce them about 50%, that goes to about 2,000. And by 75%, it reduces over that month to about 287, right? So this social distancing strategy can be incredibly effective for our area, for making an impact on how this disease progresses. I'll also just note, the estimates also suggest that over the next month, that if we enact social distancing, substantial social distancing, it's a difference between 400 people dying in the area or about 40 people dying. So it really, this really makes a concrete difference for our community. The other thing to consider is why it actually makes a difference to act now, to try and manage this? Well, if you look along the side of this axis, this is a number of people who are prevented from getting the disease, and it goes from 0 up to about 2,500 people. And this is just a model here. All right. If we act early, and that's a red curve here, we prevent about 2,500 cases by acting early. However, if we wait for another 7 days before we enact this, we only prevent about 500 cases within a 30-day period. All right. So the idea here is doing it now really will make a difference, and taking this seriously will really make a difference. All right, so a reasonable thing to ask is, what do you do if you get sick? All right, one thing is to avoid contact with others, to stay at home so that you don't infect others. There's differing data around this. Particularly if you're going into hospital settings, you should wear a mask to prevent the spread. But there's some differences of opinion about that. Some concern, particularly in certain areas, that there won't be enough masks for healthcare providers to use. So you should look at the recommendations in your area. Another is to keep the spaces that you're in clean, the surfaces clean, using disinfectants. Another thing you can do is monitor your temperature for the fever to identify if you're developing symptoms as soon as possible. If you think you might have COVID-19, the recommendation is to actually call your healthcare provider, a healthcare facility, rather than just show up there. If you show up there, one, you're increasing the burden on the healthcare system. The other thing is, if you have COVID-19, but don't have serious symptoms, well, you could spread it to somebody else. Or if you don't have COVID-19, you could get it from somebody else who's at that healthcare facility who has COVID-19. So we really want to call first. And based upon their conversation with you, they may ask you to come in to get tested if they think that you have COVID-19. And whether or not you get tested is up to your provider. There's some limitation on tests currently, so they're rationing them a bit. So they may or may not offer you a test. When I first got sick, they didn't feel like I qualified for a test, so I didn't get tested. If you do get tested, it's going to take a little while to get your results back. So it takes at least a day. Very often it takes multiple days to get your data back. So just anticipate that will take a little while. One thing to keep really in mind is that if you start having these severe symptoms, and the severe symptoms we talked about earlier, particularly around difficulty breathing, that is a situation where you do need to pursue getting medical attention. So that's to be taken very seriously. There's other things that we can do in terms of preparation. So one of the best things you can do is connecting with others and create community and create plans about how to handle this. But I'm going to talk about that in a second. The other things that you can do is, if you have necessary medications for your health, getting a backup supply so that you have plenty of medications can be quite helpful. Also having a thermometer so you can monitor your temperature if you have a fever, for example. You can also get over-the-counter fever-reducing medications, such as Tylenol or Advil or aspirin. Those can be helpful when you're having a fever. And also get a supply of food. So the current recommendation here in Washington State is to try and get yourself about a 2-week supply of food so that you'd be okay. Because if you got sick, you wouldn't want to be going out and potentially spreading the disease. So you want to be able to live in your space for that amount of time. One thing I'll note here is also the interest in not oversupplying yourself. So not buying 2 years worth of food supplies, right? So that we make sure that other people can also get food, so that we, take care of our community. So, just something else to keep in mind. All right. Another angle to this is thinking about caring for both ourselves and also caring for others. Now, community connections make a big difference. So we as communities can take care of one another. We know that there's some people who are going to be more vulnerable and at greater risk for this. So they're going to need to be extra precautious around preventing their risk for this disease. So there's things that we can do to help them out. So that might mean going and doing some shopping for people and dropping off supplies at their door. That could be a way that you could help, or keeping their spirits up and helping them in that way. Um, the other thing is that I'd encourage you to think broadly about vulnerability. So remember, this is a pandemic. So there's other countries that are going to be hit very hard by this that don't have as strong of a healthcare system as we do. And we can give money to help support other people around the world. We can also think in our own communities about people who might be more vulnerable. I've already mentioned that, people with immune deficiencies might have more challenges. You might have people who are homeless, people who are refugees, prisoners. There are communities, people within our communities that may have less ability to engage in the social distancing strategies that we talked about to prevent that spread. Another thing that we need to think about is not stigmatizing people. People will get sick, and we want to treat them with kindness and respect and not stigmatize them. And we also don't want to stigmatize people based upon where they're from, whether they're from areas that are hotspots or not. That we understand that this virus affects everybody. It doesn't discriminate. It can come from anywhere. As you're, especially as you're engaging in social distancing, think about different ways that you can make good use of your time, so you feel like you're being productive. We all think about things that we can do for self-improvement, or types of interactions that we're wanting to have. Connecting with people who we haven't talked to for a long time, who are far away. This is an opportunity to do those things, or read or learn about something. So think about this also as an opportunity to try out new things and be creative. Because that will be helpful as well. You should also expect that there will be emotional responses. This is a scary situation, and we're concerned about other people and ourselves. And that's understandable. So think about what things you do that help you to deal with these types of scary situations, and what types of supports you need, and try and identify those supports so that you can make use of them. And by doing so, it'll help prepare you to take care of both yourself and also support other people around you. So that's about it for now in terms of sort of some of the basic thoughts around coronavirus and the outbreak and what we can expect here. So in terms of what we've talked about, there's some key points. The first point being that coronavirus is a significant concern. We need to pay a lot of attention to this, and in paying attention to this, we need to note there are some people who are particularly vulnerable, and they need special care, and they need to. We also need to help them to take care of themselves in this situation. We also really want to slow down the spread because we don't want to overwhelm the healthcare system. So flatten out that curve. So that's something that we need to be attentive to. One of the main ways that we can do this, of course, is the washing hands and not touching your face. But a real important strategy here is that social distancing. So not going out and interacting with lots of people will make a huge difference, as we've shown with the data. And then also creating connections within your community and creating plans for how we're going to support each other and preparing for this as it goes forward. And we all come together to work to get through this challenge together. So thanks for listening. I hope it was helpful. Remember, this is something that we can get through, that we can support each other, and that there's a lot of things that we can do to actually deal with this situation. So there's a lot of opportunity here. So again, thank you very much. I wish you all the best, and take care, everyone.